And with us right now is Dr. Kate Sahafi. She is a dentist at Dover Dental, and it's good to have you here today.
Thank you for having me.
We are going to be talking about something that, in general, people may not think, okay, this has anything to do with a dentist, but yet you can help out an awful lot. It's called sleep apnea. Mm-hmm. So first, let's talk about sleep apnea and possibly some of the causes about it, and how does one know if they have it or not?
Sleep apnea, it's a sleep disorder. Mm-hmm. So when they're sleeping and then they stop breathing, we call that a sleep apnea. In order to be diagnosed with sleep apnea, you have to have at least 5 episodes of complete stop in breathing per hour. So when you stop, if you look at the image, while you're sleeping, the air passes through your mouth or through your nose and then get to your body. So if the oxygen stops from going down, then you have sleep apnea.
Okay. Now, it's, I think, one of the hardest things to figure out, especially if someone lives alone. If you have a partner that you're with, they're going to figure it out before you would.
That's right. That's
so
boring.
What are some of the signs and symptoms for the individual that maybe is living alone?
So one of the first signs is that fatigue. When people say it's like 1 in the afternoon and I feel like exhausted, I feel like I have no energy, I'm falling asleep while I'm watching movie, that's a big sign of sleep apnea. The second is that a lot of people say, I have high blood pressure, I keep taking medication, the doctor keeps changing my medication, it's just not working.
Really?
I have a hard time bringing my blood pressure low. That's another sign of sleep apnea. Some people have, believe it or not, acid reflux, and they take a lot of medication. They're like, oh my God, it's just like bothering me a lot. And that's a big sign of sleep apnea, acid reflux.
Wow.
And then people treat the symptoms, but they don't go after the actual cause of it. Some other signs of restless leg syndrome, people who move a lot while they're sleeping. That's another big sign of sleep apnea. Diabetes, when you gain a lot of weight, that's another sign. So there are different factors and then different things that we can see in a patient that can alert us. For me as a dentist, one of the things that I do when a patient comes in for an exam, besides checking their teeth, is that I ask them just to open their mouth. And if I cannot see the back of their throat and their tonsils, then I kind of feel like they might have sleep apnea. So that means that they have a large tongue, and the tongue it's kind of falling back, and I cannot see the soft palate. Okay. So I always ask them. I said, or for example, Steve, do you feel tired? Do you snore? So I start asking this kind of a question, and then if I get 4 yeses of my 6 questions, then I say, you know what, maybe you should go and talk to your doctor and then get a sleep study.
All right, and of course, the sleep study is, I remember taking one of those years ago. I was fine, but I think they do it a little bit easier than when I did it, because they put a lot of things in your head, and first of all, it's hard to sleep. It's like a makeshift motel room, basically. You're not going to sleep that well anyway. But it's necessary, and that comes from your primary care doctor, right? Or can you suggest that?
I can prescribe that now.
Oh, you can?
But you have to have some training. Like I went to UCLA, and I did a 6-month mini residency at UCLA for sleep apnea.
Okay.
So somebody like me, I can prescribe, a sleep study. And sleep studies are much easier now these days. They're much more comfortable when you go in there. I just did it about 3 years ago for myself, and I was able to sleep during the whole 6 hours there. And then sometimes if people say, you know what, I really don't want to go there, I cannot fall asleep anyway when I go to these places, so what's the use of getting a sleep study? No, they're home studies.
Yes, there are.
So you can stay in your bed at your house. They're not as precise as the one that you do at a sleep center, but enough to know if you have sleep apnea or not.
Yeah, in fact, nowadays you can wear like a iWatch or an Android Wear.
Exactly.
And there's actually apps that will measure. You're right. It's quite as accurate, but it'll come out with a graph that you can then read on your
Exactly.
phone. Exactly. You know, it's quite amazing, and the app's like probably free. You know?
Exactly, and if you see that you have it, then you can go for
Exactly.
a more, detailed sleep
Yeah.
study to a sleep center.
So let me ask you, before some of the things how you can help with, this can actually be something, it's not just a loss of sleep, it can actually be quite dangerous, am I right?
Yes.
For some people.
The funny thing is that when you ask, I had patients who had severe sleep apnea, and when I asked them, like, you know, do you think you have sleep apnea? They're like, no, I'm sleeping fine. But what they don't realize is that when you have sleep apnea, you're sleeping through the entire night. But what is really important when you're sleeping, it's the deep sleep. And when you have sleep apnea, you're sleeping, but every time you wake up, you're actually sleeping, but you're not getting that deep sleep that
Right.
you need to have your body, like, you know, be rested. So this is the problem with sleep apnea.
Right.
So that's why a lot of people have it and they don't know, because you're not awake totally when you wake up. You're still sleeping, but you're getting from that deep sleep phase to another phase, which is a much shallow sleep.
Exactly. So how can you help?
Okay. People, they say, why do I even have sleep apnea? Why? Sleep apnea is all about anatomy. So what happens is that, I don't know if you can get one of those slides that I have. When you're sleeping, you know, we have your tongue.
Right.
So here's a perfect example of somebody who has sleep apnea. So if you look at it, your soft palate goes down, and then your tongue falls back, and then block your airway. So the oxygen cannot get to your lungs. So why do we even have that? So it's all about anatomy. Some people have a very large tongue, and that's anatomy. You can't help it. Some
Okay.
people have muscles that are not very strong and they are weak. So the whole area here, your soft palate is not sticking out. It's falling
Right.
back, and then it's blocking your airway. It has something also to do with your jawbone. Some people have a jaw that it's retruded, that
Okay.
you don't have a correct bite. So if I see somebody who has their jaw retruded, then I always like check for like signs of sleep apnea.
Okay.
So there are different ways you can treat it. The best is, of course, CPAP, which is called a positive pressure
Right.
air that goes and then actually moves the soft palate up and then let the air go back.
Right. And that's something that, you know, I've seen before, and a lot of people are hesitant because you're basically sleeping with a mask on.
Exactly.
Yeah. And here's
how can you fall asleep with this?
Exactly.
It's
Yeah.
really hard. And then especially younger generation, they're like, I don't want to sleep next to my wife with something like this that makes noise, and then
Right.
it's uncomfortable. So at Stanford, they did a lot of studies, and they saw that then when they were doing a surgery, by moving the lower jaw forward, patients were getting 95%
Wow.
good results. And then they're like, why is that? So they came up with a device, which is, we call it like it's a dental device basically. And what it does is that it moves your lower jaw forward. As you know, your tongue is attached to your lower jaw.
Right.
So by moving your jaw forward, you're basically moving your tongue forward, moving it away from, your throat. So you're actually opening up the airway. What also this appliance does is that it opens up your bite. By opening up your bite, your soft palate goes up. So that's how it works. When you open up the bite, the soft palate automatically goes up instead of falling back. And so you open up the airway also in this way, by lifting the soft palate and by moving the tongue forward.
So you use the word appliance. Does that mean it's not permanent? Somebody puts it in at night, or
Exactly,
is it okay?
just at night.
So it's not like you're going to walk around during the day with.
No, because
so that's very convenient.
Yeah, sleep apnea is something that only happens while you're sleeping,
Right.
so you don't need to
So
wear
this isn't
that.
a surgical type thing.
Exactly,
Okay.
and surgery is hard, and this is something that, patient comes in, we take impressions of their mouth, and we do measurements, and there is only couple of labs that are specialized in doing
That's
those
fantastic.
appliances. You send it to them, they make it, so patient comes in. This is not something that you give to the patient and say, here's your appliance, go
Right.
home and then goodbye. They come back and then we adjust that appliance until patient says,
That's
I
fantastic.
stopped snoring, everything feels good, and then we send them for a follow-up sleep study 3 months later. And then that sleep study shows that, the sleep apnea has improved. And then, then that's
Very
how we
good.
know that it's,
And
it's
I
working.
want to give you a phone number, and it's 949-548-0966, and Dover Dental is located down in Newport Beach.
Yes.
It's great to see you again.
Thank you so
great
much.
information and great technique that can help a lot of people out. I appreciate you coming on, and
Thank
we will
you.
be right back.
Thank you.
Yeah, I remember.